90,000 more Johnson & Johnson vaccines have arrived in South Africa. They're part of the Sisonke trial, which has seen more than 280,000 healthcare workers inoculated so far. More vaccines are expected later this week. ENCA's Heidi Jokos was at the airport and filed this report.
Another batch of the Johnson & Johnson vaccine is in the country. The arrival of this batch forms part of the 500,000 doses initially secured by government, which forms part of the Sisonke trial. So far, government has received over 300,000 doses of the J&J vaccine, with another 200,000 expected.
We don't have direct flights from New York, and so we had to go via Europe. That delayed it, and it's obviously much safer to bring in two large consignments like this separately in case something goes wrong with the first consignment. And so by the end of this week, we will have deployed the last 200,000 vaccines to all parts of South Africa. In the last leg of our vaccination program, we're going to be penetrating the Eastern Cape, more rural areas, northern KwaZulu-Natal, and trying to make sure that people who were missed in the first parts of the program have access.
There's been much criticism around the slow pace at which government has procured vaccines, but it's been attributed to a global shortage.
As these vaccines arrive in the country, they get deployed. So we have not wasted one day. The moment the vaccines are in the country, they get deployed all over the country. As I said, these vaccines have come in over the 40,000, between 40,000 and 80,000 at a time. As they come in, they get directly deployed and utilized.
Health Minister Dr. Zweli Mkhize says more vaccines are expected this week, with phase 2 expected to start by mid-May. As of Monday, just under 290,000 healthcare workers have been vaccinated. For now, South Africans wait for their turn to get the jab. Heidi Jokos, Kempton Park.